It's loading. Hello, everybody, and thank you for joining us today. I am Stephanie Prim, and I'm the director of Love Inc., and we are a nonprofit based in Madison, and we work with adults with developmental disabilities and their families. And today we are joined with the fabulous Marcia Stickel, who's on the phone, and you can also see a photograph of her right here. And Marcia is the retired director of the WIN program, which is Wellness Inclusion Nursing, and she has decades of experience as a nurse working with people with developmental and other disabilities. And so, Marcia, welcome, and thank you for joining us.
Glad to do it.
Yeah. We also have Alyssa Hermanson, who's the assistant director of Love Inc., who's going to help us out on the phone as well. She's too shy to say
everyone.
hello. So Marcia, let's just jump right into it. So we are in the middle of a pandemic, and all of us right now are practicing social distancing, and we're all staying home and staying away from public places and other members of the community. Can you talk a little bit about why we're doing this and why it's important?
Sure. The tricky thing about the coronavirus is that most people are not aware of getting it and how they're getting it, but it has been shown, and that has been consistent since these several months, that keeping distance prevents you from getting the virus, because the virus is in droplets, meaning when somebody coughs or sneezes, that's where the virus is, and it will not go further than 6 feet. It will fall to the ground or fall to surfaces. So by keeping social distancing, keeping that 6 feet between you and any other individual, you are not going to get their droplets from their sneezes or coughs onto you. And so that staying safe, staying home, is that as you avoid being out in public, you are avoiding the possibility of the virus being on surfaces and being unable to avoid being closer than 6 feet. There's one thing that has just recently come up in the media that I wanted to address today, and that is, as more and more people are wanting to be outside, and as the weather, not today, but last week, was warmer, Madison especially is very focused on bike paths and walking, and there's many of them, but they've gotten pretty crowded, and there was a warning about that not being able to keep 6 feet between you and somebody else. So it was quite strongly worded this week that if you're wanting to go on a path, whether biking or walking, and you see it's very busy, go somewhere else. So that up till now really hadn't been much of a concern, and it is strongly encouraged to get outside and to get exercise and fresh air, but we do still have to social distance even outside. And that leads right into the face masks, because I was thinking we don't need to have face masks outdoors when we're going for a walk. And that is true if it's in an area where you're not going to be at risk of coming closer than 6 feet. But if you're anywhere where it's a more populated area, sorry, but you really do need to wear a face mask. If even outdoors, if you're going to be where there are other people, as that you're going to see as you walk or bike.
Yeah, and that's, I think, really important advice, because there's been a lot of confusing information about face masks in the news in the last week or two. And so I have a face mask here with me that I'm going to put on to demonstrate, kind of a face mask and how you want to put one on. But Marcia, can you really talk about what the purpose of these face masks are and when and how to use them, or when they're recommended?
Yes, so we are not to use the N95 specialty masks that are for hospital personnel only. There's a shortage of them. We're not to use the other kind of surgical masks that people in hospitals would use if they're not working in a COVID-19 area, um, because those too are in short supply. Instead, we are to make a mask or a face covering of different types. I can't see what Stephanie has, but from what she's described, it's one of those stone ones, and they're much, much more readily available now. You can purchase them. You can also do a folded one. The CDC.gov has an example of several kinds of handmade ones that you can do. Some involve sewing and several do not. The purpose is really, if everybody wears a face mask, the person who may be coming down with COVID-19 and not having any symptoms, wearing that face mask protects others from that person. Also, some people, usually it's younger people without any coexisting conditions, and may not have any symptoms at all, even when they have COVID-19. And again, if they're wearing a face covering, a mask, they're protecting other people from their coronavirus. And so the whole purpose, and that's what has changed, because the United States initially said, no, don't wear a mask unless you are having symptoms. But now they're learning from other countries who have found if you wear a mask, you are protecting other people. And if everybody wears a mask, then people are used to seeing others with a mask on, and that can be effective in protecting the population as a whole.
Okay.
Did you get it on?
Everybody saw when I was handling my mask, and when I put it on, I was only touching it by the part that goes around my ears, and not touching the middle part, because the middle part is what's going to be collecting those droplets. And if you touch that with your hands and then touch other surfaces, you're moving those droplets around, which is what we're trying to avoid doing. So just
excellent.
As you're putting it on, that's something to be really aware of, especially it might be difficult if you wear glasses like I do, and I had to kind of adjust it a little bit. But it's important to not be touching the mask itself, but just touch the part that goes around your ears and the edges of it.
And so yes, there's two pieces of information that are really important to think about regarding the face coverings or masks. I happen to live with an individual who has a hard time understanding about wearing the mask. And so when we went to the store, which we needed to do it, he needed to come with me. I had one for him. First thing about that was I had to make an adaptation. I did the folding of a bandana, which you can see on the videos. It was not quite wide enough, and so the elastic bands that were going around his ears were pulling his ears, and there was no way he was going to keep it on. So I adjusted it by using safety pins to hold the folds, because the folds couldn't be completely to the center, if you can picture that. Then when we were at the store, what I found was it didn't seem right to him to have that on his face, and so he was fiddling with it. Then he took it off. Then I said, you need to put that back on, and then he put it back on. And this happened at least 4 times in the time period we were in the store. And my conclusion with that is that for him, wearing a mask would be causing more of the possible virus to be on his face, because he was continuing to fiddle with it, and then he was touching things in the store, and then he was touching his face. And so if there was the virus on any surface, he was certainly bringing it to his face.
Mm-hmm.
So from that, I think we need to be practical for individuals with whom we are encouraging a mask. If somebody is intolerant of the mask or is continually going to be either removing it or fiddling with it on their face and then touching their eyes, their nose, possibly their mouth, then it's, I think, more practical for them not to wear a mask. This is assuming that they are not symptomatic at all.
Right.
That's a different thing, and it's going to be tricky if somebody is symptomatic and coughing and sneezing. Frankly, if somebody is doing that, they should not be out in public at all.
Mm-hmm. Yeah, right.
So then the other thing is, for the rest of us, if we're able to tolerate the mask, the face covering, and we keep it on the whole time we're out in public, then when we remove it, we need to clean it. And that needs to be in hot water, if at all possible. If you can have a fabric that will tolerate hot water and soap, that's what kills the virus. And that will kill any bacteria, too, that you might have gotten on it from just breathing and getting it moist.
Mm-hmm.
Then, if you're just washing the mask, it's not practical to put it in a washing machine. But you can wash it by hand with hot water and soap, and it does need to be dried with heat. And so it seems pretty silly to put one mask into the dryer.
Mm-hmm.
But if you have a hair dryer, you can kind of hang it up or hold it with one hand and blow it dry with the heat of the hair dryer, and that will be a sufficient heat to also be effective and to have it ready for the next time.
Okay.
It is really important for people who are caregivers to put on a mask when they're going in to work with an individual.
Mm-hmm.
Again, the same thing. It's a protection for the individual in the home if the caregiver wears the mask. When the caregiver leaves that home, that mask needs to be removed and put in probably, I would encourage maybe a plastic bag or container.
Mm-hmm.
Hands should always be washed before putting on the mask, and then when you take it off, wash hands again. Warm water, sing your
wellness
happy
song.
wellness to me.
Yeah.
Yep. And then when you go to any other place, if you're working with anybody else, or you're going out in public, put another mask on. So we are talking about having more than one if you're in a kind of work situation where you may need more than one in a day.
Mm-hmm.
What else? Is there anything else that I've forgotten to include here?
No, I think that covers it. So it's really about protecting other people from any respiratory droplets that you may be exuding. So wearing a mask does not mean that you don't have to worry about social distancing.
Oh, good point. Yes. In fact, that has become an issue where people think, oh, I'm safe.
Mm-hmm.
I've got a mask on. Mm-hmm. And no, you still really, really need the hand washing. There's no doubt from December on, what we're hearing is consistent that you need to wash your hands with warm water and soap.
Mm-hmm.
And that is effective. That is effective in killing the virus.
Okay.
So that still needs to be done. You still need to keep the 6 feet between you and somebody else. And you still need to limit as much as possible going out in public. That's just the way it is.
Mm-hmm. Yep.
One other thing that has come up is about the groceries, and it looks like that's the next question.
Yeah, absolutely. Let's go.
Yeah, so grocery shopping, there's been a lot of different information about it. What is consistent is go space your grocery shopping as much as possible.
Mm-hmm.
So for myself, I now buy groceries once every 2 weeks. I buy enough plan for it so that I only go to the grocery store once every 2 weeks. I'm in the risk group because I'm over 65.
Mhm.
I wear the mask. I wash the handle of the grocery cart.
Mm.
And what they strongly encourage, and this is what I've found when I was at the grocery store almost 2 weeks ago, I need to go again this week, is people were going by themselves. And they strongly recommend if there's only, if possible, one person only from a household to grocery shop. And that's just, it's numbers. It makes sense, right? If you have one person, you have one person who has to be careful about what they touch and how they need to hand wash afterward. If you have a whole family and you've got kids touching things and everything, you've exponentially increased the risk.
Okay.
And you've increased the risk of people getting closer to each other than 6 feet as well. So one person from the household to do the shopping. After you've gotten your groceries and put them in the car, you should wash your hands again with a cleaner before you get in the car and handle things in the car.
Okay.
Then when you come home, you have a choice. Oh, one other thing about numbers.
Mm-hmm.
Try to go to one store only.
Mm.
The more stores you go to, it's that number thing again.
Mm-hmm.
The more you increase the possibility of you touching things that have the virus on them or coming into contact with people closer than 6 feet without, just by accident, not meaning to. So you've gone one person to the store and coming home after going to one store only. You bring your groceries in, and you can follow the instructions that was in March, the instructions about wiping down the groceries. Now I just recently, actually yesterday, read an article where infectious disease doctors and others are saying it's not necessary to wipe down the groceries with a disinfectant.
Okay, so that's
but
new.
You can do it. And basically, really what they're saying is if somebody is like immunocompromised, meaning they're really at risk, then it might be worth doing it.
Okay.
But just a standard recommendation is when you get all your groceries put away, then wash your hands with soap and water, and wipe down the surfaces where you had placed them.
Okay.
And that's pretty much so, like, you don't keep touching a surface that might have something on it and then rub your eyes, which many of us do.
We all do it.
Yeah. So again, it's, you can watch the video. If you want to do wipe downs, you put your grocery bags in when we say unclean area, we don't mean it's dirty, but it's not the area that you're going to put the disinfected things on. So you put them there, and then you wipe them down and put them on the clean surface. I really want to emphasize, though, the more recent information is do not wash fresh vegetables in soapy water or fruits. Okay. We strongly recommend eating fresh fruits and vegetables, but don't wash them in soapy water, even though the one kind of well-known video does show that. The reason is if it's not super, super carefully done as far as rinsing, and you have soap left on your food, it can make you sick to your stomach, give you diarrhea.
Okay.
And we certainly don't want to do that. That's all we need for people to feel discouraged about eating fruits and vegetables, right?
Yeah. Not to mention worrying that they're coming down with coronavirus if they're...
Right. And so what they do recommend is rinsing. You can rinse your fruits and vegetables before you eat them, or when you get them home, just rinse them in water from your tap, and that should be that should be sufficient.
Does it matter what temperature water you're using? Is it preferred that it be hot water or warm water or cold water?
It didn't. There's no preference was
Any water at all?
mentioned.
Okay.
Any water, just rushing water, so it's running over them.
Okay.
So yeah, it seems like it's not such a big deal. They feel like the risk is really low for it being on containers, and then you getting it from the containers. As long as you're careful washing your hands. There we go again.
Comes back to that.
Washing your hands with soap and water.
Yeah.
That's the key. And then one other thing about groceries, though, that I think is really important to understand: putting things in the freezer. So if there's the coronavirus on, say, the packaging of meat, and you put it in the freezer and you take it out a month from now, that coronavirus is going to be strong and healthy.
Okay.
It just exists just fine in either the refrigerator or the freezer. So it cannot tolerate heat, however.
Okay.
So that's a really good thing.
But it can.
Heat kills it, soap kills it, disinfectant kills it.
Okay.
Disinfectant, if it's viable. And so I just want to insert a thank you to Alyssa and Stephanie, who informed me yesterday. If you do the bleach solution, which we talked about previously, that bleach solution is only good. It's only potent for 24 hours. And I was not aware of that. So just want to make sure that if you do the bleach solution, which is the 4 teaspoons of bleach in a quart of water, use it fresh. Use it that day.
And then dump
and they are still strongly encouraging using disinfectant. In fact, the CDC is very, very adamant about that if somebody in the household has the virus.
Okay.
Things need to be wiped down repeatedly to prevent other people from getting it.
Okay. But that bleach solution that you made 2 weeks ago is no longer going to be disinfecting. So you need to mix it up fresh.
Right. It does need to be fresh.
Okay.
Yeah. So that's that's a really important thing to be aware of. So we still have hydrogen peroxide if you can get it. We still have other kinds of, well, if you can find the wipes, the Lysol, those, there's disinfectant things. I'm not sure if they're still so scarce to obtain. But those are the most convenient. Rubbing alcohol, the strong alcohol that you get, that still works. That's both hydrogen peroxide and rubbing alcohol. You use undiluted, so you just pour it out onto a paper towel or something, or on the surface, and then wipe it.
Right. Okay, so it's only if it's a diluted, as I'm trying not to touch my face on camera, it's a diluted bleach solution has a shelf life of 24 hours. Other cleaning products have maybe an expiration date that you should be aware of, but they don't have that same 24-hour shelf life. Okay. So one thing.
Go ahead.
One thing that people are hearing about in the news and reading about a lot these days is when will this end, or how will this time period of kind of extreme distancing and the safer at home, what will the end of this look like? And so I had asked you what your thoughts were about that, and how we might transition back into life as we knew it before COVID-19. So if you want to talk a little bit about what you think that might look like.
Yes, and I keep reading. There's a lot of conjecture and a lot of concern, and it's not necessarily just what's best for people's health, but the concerns about the economy, concerns that politicians have about their popularity and all of that. Right now, what they're talking about is gradual opening of restaurants and other kinds of places. It's going to take time.
Mm-hmm.
It's absolutely not going to go away quickly.
Mm-hmm.
And there will be resurgences, new waves of it if it's not carefully done. There's different possibilities of ways of opening up for people to be out and about more. I think it's going to be and should be expected that people who have conditions that make them in more danger, like asthma, or if you're over 65, there's other conditions, if you have an autoimmune disease, the people who are more at risk should expect they're going to need to continue to stay safe at home longer.
Sure.
I just read a new article today where they're talking, well, maybe 3 months or whatever, but that's all conjecture. We don't know how long it's going to be. A big factor is going to be when they develop medicines to treat it, and most of all, when they get a vaccine.
Mm-hmm.
But a vaccine is a year to a year and a half out, so that's going to be a long wait for the vaccine.
Sure.
And probably the biggest thing is if testing becomes widely available, so that it then is determined who has it for sure, for real.
Right.
So right now, who gets tested? Well, first of all, it's people who are in the hospital.
Mm-hmm.
And then it's people who are like hospital workers,
Mm-hmm.
right?
Yep.
People who are in nursing homes, people who are first responders. So it's the people where they feel it's just so important that they have to be tested. But for most people who are 65 and older also who have health conditions, like I talked about, heart conditions, respiratory conditions.
Mm-hmm.
For the rest of us, we're not going to get tested. So it's really frustrating. There's just not enough testing capability at this point.
Right.
And so if you have symptoms, they tell you to stay home and treat the symptoms.
Mm-hmm.
And then you're left wondering, well, is this COVID-19? Am I now going to be fine? They also don't have an antibody. So there's two parts. There's testing that can determine if you have COVID-19.
Mm-hmm.
And then there's testing for antibodies to know if you've had it and you've recovered from it.
Mm-hmm.
And the antibody testing has a lot to be done as far as making it more accurate.
Okay.
So they're still working on the accuracy of that.
Okay.
And then just the testing for COVID-19 itself, there's just not enough tests available. And so that will be a big factor. If testing becomes available to the whole population,
Mm-hmm.
so people can be tested and then trace who they were in contact with
Mm-hmm.
before they came down with the COVID-19, and then those people are notified. That way you can quarantine people who truly have it
Mm-hmm.
or are at strong risk of getting it within 2 weeks, and other people can be out and about.
Okay.
So that's what we can hope for and look forward to.
So to look for that increase in testing as kind of a signal that it's maybe going to start to be safer soon.
Yes.
And if you're
testing and tracing are important.
Mm-hmm.
Yep.
Yep. And if you're talking to your elected officials, to be mentioning to them that you are concerned about the availability of testing and you would like to see more of that, I think is something important to highlight for that. Marcia, I did want to circle back really quick. There was a question in the comments, just a clarification. So when you are disinfecting a surface with either a bleach solution or some other kind of disinfectant, that solution or that surface needs to be cleaned prior to disinfecting?
Oh, absolutely. Yes. The disinfectant won't work if there's soiling on the surface. So first, soap and water, then the disinfectant. And then the other piece that I didn't mention that needs to be repeated is the disinfectant needs to be allowed to dry on the surface. So you don't want to wipe it off. You need to let it dry for it to be effective. First washing any soil off, then put the disinfectant on, and then let it dry. So it's kind of like a 1, 2, 3.
Okay, that's helpful. Thank you for clarifying that.
Yeah.
So we talked just a little bit about that disinfecting is really important if someone in your household is sick. Do you have any tips or advice for people who may have family members at home who are having symptoms or who even maybe have tested positive for COVID-19? What should they be doing to kind of keep the rest of the house safe?
Yeah, the challenge is, and I'm well aware that what is recommended could be challenging for an individual who has a developmental disability. But the best way to treat it is to isolate the person within the home. So the person would have his or her own bathroom and would stay in their own bedroom. So using that door as a way of keeping the person separate from the rest of the household, using bringing meals to the door. They open the door and get their food. So that all sounds wonderful, but it's probably not very practical for individuals who are challenged. If the person is going to be out of their room, they're not isolated behind that door, they definitely should wear masks. And then those masks should be taken care of the way we described. Their clothing, their bedding, their towels, all of that should be gathered. So again, if the person's able to, he or she should get all of those things and put them in a basket. I prefer a lined basket so you can throw away the bag. Otherwise, that also needs to be clean. And set it outside the door of the bedroom. The caregiver should then wash them, again, hot soapy water. And the person who's the caregiver should be wearing gloves when they do that, and then they need to clean the gloves. If you take off gloves that likely have the virus on them, you need to put your hand inside the gloves. Well, the first one you'd grab with one glove and pull it off. And then the second one with your clean hand, you'd put your hand inside the glove and peel it off. It's kind of second nature for me as a nurse, but you want to be careful not to contaminate yourself with dirty gloves. So you're doing all of those things to decrease the risk for the rest of the household. If the person can't do those things for himself or herself, you're going to need to go in, you're going to need to wear a mask. You're certainly going to be wearing those gloves. You're going to be cleaning every surface, doorknobs, cell phones, everything with disinfectant after washing them. Obviously, you don't wash your cell phone, so you got to come up with a way to keep that as clean as possible. I've seen recommendations, can you put a plastic covering over a phone? And I don't know if that's practical or not, or an iPad or whatever a person might have to try to keep busy when they're in a situation like that.
So yeah, it's important to just really ramp up that disinfectant
yes.
capability.
Yeah, we're really talking about multiple times a day. If this person has, been in the bathroom, especially if a person has to share a bathroom with the rest of the household, the person with COVID-19 uses the bathroom, and then goes back to their room. Somebody else needs to go in and clean and disinfect each time, really, to prevent the spread of it. I know that's a hassle, but that is a reality.
Yeah. Marcia, circling back to kind of the topic of how this is going to come to an end, one of our we have a comment and a question in the chat feature for YouTube Live here, and somebody wants to know when they might be able to go back to work. And I realize you don't necessarily have an answer for that, but if you have, again, just any thoughts about what time frame it might look like for folks to get back to
Right.
their jobs.
And I feel so sad for many people who have lost their employment. It really is going to depend on what government officials allow. Um, so I think the 24th was that what Governor Evers said was going to be the first date. I think that's premature. My guess really is probably May. It may depend on what kind of precautions can be implemented in your work. It may depend on your age too. So if you're a young and healthy individual, if you're 40 or under, I don't know, it might be 50 and under. You're much less risk as long as you don't have any of the chronic conditions we've talked about, which, respiratory, cardiac, diabetes, cancer treatment, any kind of immunosuppressed individual, you would be able to go back sooner. That's what we're expecting.
Okay.
So it really also depends on, if you work in a large group area, that might be a hindrance of going back sooner than later. So I'm sorry, most of what I'm saying is full of ifs.
Yeah.
But that's as much as we know right now.
Yeah. Folks should be prepared to wait, and then it might be a while longer before you can go back to work.
Yeah, I think May is the soonest, and it may be longer than that. We just don't know. Then the other piece, unfortunately, is if they open everything wide up to try to get everything back to normal, there could be another wave of very sick people, and that we hope that doesn't happen. But that's why a gradual opening of things certainly would be, from a health perspective, would be the better way to go.
Sure. Okay. Another question that's been very popular that we've heard a lot is, can my pet, my dog or my cat, get coronavirus? Do I need to worry about them getting sick if I have it?
Right. There is a possibility, but it's a very, very small possibility. Okay. From everything I've read so far, now there was a tiger at the zoo that got sick from his keeper that had COVID-19. Other than that, I've only heard about 2 pets in the whole world that got it, and they did get it from their master. So I don't think you need to worry. I think it's like, 1 in a million chance, really. But you can be careful if you want to, certainly. I just think it's, a pet is a lot of comfort, so I wouldn't feel like you had to farm your pet out if you got COVID-19.
Okay, good to know. Thank you. So another question that came in from one of our members was, their son is sleeping 15 or more hours a day right now because they're not doing their normal routine. They're not going to work. They're bored. They're sad. They're confused. All of those things, and they're kind of coping with all of this by just spending a lot of time asleep. Is that dangerous? Is that something folks should be worrying about? How can folks maybe break that cycle or break that habit?
Yes, 15 hours a day, that is a problem. It's not life-threatening, but the more time you spend in bed, especially sleeping in bed, you do lose some muscle strength. Any of us would. So you could also, if a person has some physical challenges, and then they're not using their body in the way they typically would, they could lose some of their physical abilities. It's it's not life threatening, but it's not recommended. So in general, if somebody has a 15 hours of sleep once a week or something, I'm not worried about that. If it's a consistent thing, though, that could be not a good idea for their health. If somebody isn't able to roll and reposition or isn't aware of when they have discomfort, you also run the risk of a person getting pressure sores from lying in bed and not having that movement. So for those reasons, I would encourage strongly that most people can, 10 hours should be fine. 12 hours max in a day, typically. I would recommend establishing a new routine. So making sure the person does get up. I mean, I don't really care if the person goes to bed at midnight and they get up at 10 in the morning. That's okay, but they need to get up. So getting up, having possibly a little bit of caffeine in whatever they drink in the morning, just in the morning, and it depends on the person's basic health, to kind of give them a little boost. And then having some plans for the day. So I was talking to my son, daughter-in-law, and grandkids in Colorado, and I said, how are they doing? Because they could get bored easily. And what my son said is they have a plan. So in the morning, they have a schedule of things that they can do for the day, and they have that plan, and that's what they follow. And he was saying how much that helped, and I think that certainly would be a good idea for many of us. So for this son, if he had a plan of things that he could do, and again, it's tricky because it's different, but jigsaw puzzles, I hear, are sold out some places, but is that something the person could enjoy? What about paint by number or coloring or a video of exercises to do in the house? Having a planned outing every day outdoors, whether it's in the yard or on a balcony, or out for a walk. So really, really planning activities. Otherwise, I think it can be depressing, and you can't think of what to do, and so you just drift off to sleep.
Yeah. And with the pressure sores, so if someone had been had developed this habit and was sleeping for a good chunk of the day, is there a good reason at this point already to maybe either ask them to check their skin over for any redness or sore spots, or check it if they're not able to check themselves? And what are the areas that folks should really focus on if they're
right? So think of any part of you that's kind of where the bone is close to the surface. So elbows, shoulders, backbone, especially the lower back, your spine, hip bones, knees. So if your knees are kind of together all the time, and the little bumpy bones on your ankles, your heels. If you're lying on your back, your heels can get sore. You're wanting to look for red. So redness is the red flag for pressure ulcers, pressure sores. The tricky part for some of that is a lot of what I described is on the back of you. So unless a person's able to look with a hand mirror to see the back of them in a bigger mirror, they may not see those areas of redness. And we really, really, really do not want to wait until there's an open spot,
Right.
because that can be much more difficult than to deal with and to treat.
Mm-hmm. Yeah. No, that's very hard. Okay, so that's what to watch out for if sleep has kind of become a coping strategy, and some ideas for how to interrupt that pattern. Um, I'm also hearing from a lot of folks that food has become a way that they're coping with this disruption and this change. And um, I'm not going to say it's not happening to me, right? I've definitely eaten some things that I wouldn't normally eat during the pandemic. So, what do you recommend folks do around food, and maybe some healthy snack ideas that you could recommend so that people can, try to balance it out a little bit?
I think it's tricky because we tend to do emotional eating, not just the individuals where the parents are concerned, but all of us. And I can say for myself, if it's there, I'm much more likely to eat it. So I never, just for example, never bring Fritos home to the house.
That's your danger one, right?
That's my danger. I'm not likely to limit myself. And so I know that. So in thinking about that with your loved ones, you don't want anybody to be deprived, but you want to limit access. So what you bring into the home is going to get eaten, and it might get eaten rapidly. So some ways that you can deal with that is to, it's more expensive, but if you buy small quantities of things, so that a person can have, say, a 100-calorie pack of almonds instead of having a jar of almonds, or peanuts or something else, so that the person can still enjoy some of those things, but in limited quantities. The little ice cream cup instead of a 48-ounce container of ice cream. Because some people will sit down and eat a whole container of ice cream. And pounds can add up very quickly. 100 calories extra per day over a year is 10 pounds.
Wow. And
so we're hoping we're not going to be social distancing and staying at home for a year, but probably if you're overeating, you're getting a lot more than 100 calories extra per day. So other things to bring home that are snacky, that are pretty much lower in calories, would be things like popcorn. Pretzels aren't too bad, not near as bad as chips. And you can buy, say, snack packs of pretzels, apples, and then, cut them into slices. Celery with a little peanut butter. You can dip the apple slices into yogurt. It's kind of a fun snack. The other thing I've had some people do is get Chex. So I'm not talking about Chex Mix, because that can really add up to calories. But corn Chex and rice Chex by themselves are crunchy, and they're pretty low in calories. And they have a little bit of a salty flavor to them, so they really can be a good choice for a crunchy munchy snack. Pineapple, or the pineapple chunks, you can put those. And again, we're not talking about eating the whole can. There are the fruit cups, so if a person wants to have them that way, they could. So those are kind of raisins, like the little box of raisins. Those are kinds of snacks that are kind of in limited quantities. The other thing I would say is you really have to know the person. So while it's wonderful to shop every 2 weeks, if you bring all that food into a person's home and he eats it in 2 days, you've defeated the whole purpose of planning to be healthy. So if a person is challenged with wanting to just eat and eat without limit, then there needs to be found a way to have just the reasonable amount of food accessible to the individual. Whether that's a locked safe, I think they have food. Stephanie, you're the one that knew about the locked food safe, I think. Or, the food is kept off the premises and brought in daily. Whatever creative and practical ways you can have for a person to have sufficient food. Deprivation is not what we're talking about here. We don't want anybody to feel deprived, but we want them to be able to have reasonable limits on their eating. The other thing I would encourage, and it kind of goes back to having a plan of a routine, any kinds of crafts, any kinds of things like the jigsaw puzzles or coloring, all of those things that keep your hands busy can be helpful so that you're not using your hands to eat.
Okay.
And one other possibility is for some people, well, I'll be honest, for myself, I keep sugar-free gum in my house. And if I'm feeling like I want to eat, I mean, this is not when I'm really hungry, but I just feel like I want to eat, I will chew gum for a while. And, of course, that depends on if the individual can chew gum and won't swallow it. But sugar-free gum is also helpful for your teeth. It actually has a preventive called xylitol in it that helps prevent cavities. So it's not a bad thing for sugar-free gum to be in the house if a person can handle it.
Okay. That's really helpful, all of that, Marcia. I think, the big thing is just, if it's not in the house, you can't overeat something.
Yep.
And so, just being really mindful. It's difficult because we're supposed to be shopping less frequently and kind of stocking up. But if that additional supply is going to lead to overeating, that kind of zeroes out the health risk, or kind of makes it maybe wiser to just shop more frequently or store the food somewhere else if possible.
Okay. Yes.
Another question that some families are kind of struggling with right now is their son or daughter lives in their own home and has caregivers, paid caregivers that are coming in to take care of them. And the parents, are debating whether or not it would be safer for their son or daughter to come and stay with mom and dad during this time period, just because there are so many caregivers maybe coming and going from the home. But parents are also kind of in the risk category due to their age or other health conditions. So introducing their son or daughter back into their home when they're not sure that they're healthy is something that they're kind of worried about or nervous about. So what advice or tips do you have about that?
So again, this is one of those if answers. First of all, I would think it is a good idea to have the son or daughter return home if mom and dad are in good enough health to be able to provide whatever help their son or daughter needs. And if there are no symptoms for the son or daughter when that person returns to the family home, but with this extra caution, initially when that son or daughter returns home, I would strongly encourage some of the care, the first few days especially, of keeping the person separate, the child, adult child, separate from the parents as much as possible to make sure that he or she doesn't come down with the COVID-19 virus, over a few days. It can take up to 2 weeks, but typically it doesn't take that long. And so, having the son or daughter return home with caution, I think, is going to be safer than having many caregivers coming in and out of the home. I do want to say that I think any parents should expect that all caregivers take their temperature every morning before they would come to care for a person. And we talked about the masks and the hand washing, but still, the reality is, young caregivers, the more caregivers there is always an increased risk. It's like the numbers that we talked about with grocery shopping. The more people that come in contact with an individual that have been out and about and living with family members and so on, the more risk there is of COVID-19. However, if parents are not in good health, then they need to weigh the risks for themselves, and certainly if they're not in good enough health to help care for their son or daughter in their home, and then they bring caregivers into their home, that amps up the risk way beyond what you'd have if you lived separately.
Sure. Okay. So it's kind of a obviously a very individual decision, and there's just
very individual.
A lot of different factors to take into consideration when you're making those calls. Okay. Marcia, was there anything else as we wrap up that you think you want to leave folks with? Any tips or advice or things that people should be watching for, paying attention to in the news?
Yeah, I think, it's just a good idea to keep an eye. I'm sure that when things are going to start to open up, there's going to be a lot on the news about it. So, it will be good to just keep an eye and an ear out. But really, my heart goes out to each person struggling in this situation. Really want to encourage establishing a new routine for those people who are struggling with being depressed and frustrated, and be creative. Use the time you have, the extra time you have, to come up with ideas of things that might be useful and interesting to do. Use electronic media usefully. There's a lot of different places where you can access, like the zoos and different places that are interesting, and also you learn something from them. But being patient is probably patiently continuing to do what you need to do is probably the biggest message I would have. Continue to do what you know is the right thing to do, even though it's really challenging to keep on doing it. It seems like it's going to go on forever, and we know it won't. But there are risk things you can do, like staying in bed a lot and eating a lot. You can have 30 pounds extra weight on. You could have sores or a loss of function that is going to be a problem beyond this time, when we do no longer have to follow these kinds of rules.
Right. Yeah. So it's important to take care of yourself and stay healthy too.
Yes.
Well, thank you so much, Marcia, for your time and your expertise. I really appreciate it, and I'm sure all of our listeners do as well. And to everybody out there, just take care of yourselves and stay healthy and safe. And we'll talk to you soon.